Good evening and welcome to another series of Fresh, Natural, and Live. I hope your Monday has gone well, and of course, I hope your weekend has gone well. We have a very special show for you tonight. We're going to be I've invited a special guest, Dr. Shaw. She's been with us before, and she's going to educate us on the science of acupuncture. And so this is an area that I've been very intrigued about over the years. I've actually had 2 acupuncture treatments in my lifetime, and I've prescribed it for patients before, but I haven't had the time to delve into the science and the background of it. So I'm especially interested in learning more about acupuncture, and we're going to get into a lot of details about the history, the science, and some of the clinical applications. So, get set, get your pen and paper ready. We got a great show set for you tonight. Let's go. Okay, welcome back. So many of you may have seen our series on homeopathic medicine, and Dr. Shaw came on and helped us with understanding that very special area of natural healing. She's also an expert in acupuncture, and tonight we're going to talk about the concepts of acupuncture. And as those of you who may not have met Dr. Shaw on another show, she's a practitioner. She was traditionally trained in allopathic medicine, and has 25 years of experience under her belt. She has special expertise in homeopathy, acupuncture, and Chinese herbal medicine. And so she uses all of these either interchangeably or in combinations to help her patients. I've actually referred patients to her with special problems. And so she has practiced in 3 locations in the Houston area, in Houston proper, Sugar Land, and Brenham, Texas. And so acupuncture is an area that she's going to educate us on tonight. But without further ado, I'm going to bring Dr. Shaw on stage. Hello, Dr. Shaw. How are you doing today?
Good. How about you? And thank you for having me over.
Fine. Thank you. So, the issue of acupuncture, this is something a number of my patients have had acupuncture before. And I've had, patients and other people I know who've had this therapy for different reasons. Of course, historically, I've always thought of it as something being very beneficial for musculoskeletal problems or inflammatory musculoskeletal issues. But it seems to cover a broad spectrum of things. And so hopefully we'll get into that. But can you just start us off with a little bit of a discussion on the history of acupuncture? What's the origins, and where did it come from, and kind of take us from there?
Yes, it's one of the very ancient system of medicine, and it's part of traditional Chinese medicine. It's one of the branches of traditional medicine. Includes acupuncture, herbal medicine, Toina, which is form of massage therapy, and also Tai Chi Qigong, which includes meditation and exercise routine. Acupuncture has become extremely popular in the United States in last, I think, since 1970. And the history goes back almost like 3,000 years ago. And it was started more by using pressure points, like ancient, during the archaeological digging, they have found that like in olden times, they were using stones, pointed stones, and even bones of small animals, fish bones, to specifically puncture certain points on the body. And the whole idea is to kind of balance your system. And that's where the symbol of yin and yang comes in. Like you always want everything in harmony. You want to have good blood and energy circulation to all the different body, and you going to achieve that by stimulating specific points on the body. You can do it by applying pressure, which is called as acupressure, or you can use fine disposable needles, which is called as acupressure.
Gotcha. Your microphone, you're cutting out a little bit. I don't know if you turn your microphone up or not. It may be.
How about now?
That seems better. Yeah, that's a little bit better. And I'll kind of monitor it. So basically, about 3,000 years ago, they started using, even before they were using puncture, there were pressure points. And
Yes.
you mentioned the word massage. And so is there some connection with massage therapy as well? Or am I just stretching it too much?
Yes, no, there is some connection with massage therapy, but over time, they started focusing on specific points and using it more as acupressure. So some of the acupressure points can be used for massage also.
Gotcha. So how is this? I mean, you mentioned certain points and balance. I mean, I guess in general, how did they discover these points? I mean, I remember someone telling me to, if you had a headache, you can press sometime between your thumb and index finger, and that can relieve. I mean, I don't know. I mean, it seemed to work. I don't know if that's placebo effect or not, but how did someone delineate these different points?
So it was more with clinical experiments. They realized that like by pressing certain points, the person started feeling better. And interesting thing is lots of times, if the patient are having certain problem, like for example, over time, auricular acupuncture has also become very popular, which is ear acupuncture. And ear acupuncture has all of the body inside it. So there are points for stomach, liver, feet, back, head, eyes. And patients who are having acid reflux or gastritis, interestingly, there is a small eruption, boil, or discoloration on the stomach area. And that gives you an indication that that particular person is having some issues with stomach problem. So similar to that, even on hand, like the point which you mentioned, which is between the index finger and the thumb, it's an extremely powerful and useful point used for headaches. So lots of times patients who are experiencing headaches, you might see some discoloration, or they might mention it's tender. There might be some eruption. And they started using more and more points like that. And even with stomach problem or stomach pain, they would use points on the stomach. And they started kind of noting down all those different areas of the body and how it would help with the patients or with persons having certain signs and symptoms. And as the time went by, it was developed more and more.
You mentioned eruptions. I mean, can you explain that in terms of eruptions? Is that like a tissue finding, or is that an eruption at the site of where is that a neurological eruption, or what's the nature of that eruption that you mentioned?
No, it's interesting. It's just kind of like body shows on the surface. Like, for example, patients who suffer from asthma or emphysema, there is a very well-known point on the back, which is upper back, which is used for the treatment of diseases associated with lungs in acupuncture. And lots of times patients who have suffered from emphysema or asthma, I have noticed that like at that particular acupuncture point site, they might have a small boil, or they might have some kind of discoloration, they might have mole. And the patient will mention, like, I don't know why, but I have been itching that area. I have been having some rash in that area. And when it coincides with specific acupuncture point, I end up asking patients whether they have been having some issues with lungs, or whether they are having issues with stomach, or they have any liver problem. And that was also used as a diagnostic tool in traditional Chinese medicine. So that's very interesting. It's kind of like the body shows that there is some imbalance going on with internal organs on the surface. There will be some change in skin. So it will be, like, as I mentioned, like there might be some rash, some eruptions, some boils, abscess. So it's very interesting.
The skin eruption. I see. Wow, that's fascinating. So an eruption or skin reaction in some part of the body is reflective of an underlying abnormal biochemical physiological process somewhere else.
Yes.
As you said, like in the back of the neck, it could be respiratory,
Yes.
asthma, or the like.
Yes.
That's quite fascinating. I mean, that leads into the next section in terms of the science of acupuncture. You know, you have an allopathic training background, and of course, we're in allopathic medicine. We like to draw blood tests or an imaging study, or I guess a skin eruption might be good too. What are some of the mechanisms of how things work? What are some of the measurements that's been taken to, I would just argue, validate or substantiate the cause and effects of these acupuncture treatments or pressure point treatments?
So recently, one study was done in Germany and also in Japan. So when they started using, when certain acupuncture points were stimulated, for example, if you are treating a patient for lower back pain or for sciatica, certain points on the legs were used for the treatment purpose. And when they did CAT scan of those patients, they saw that like the leg and the hip joint area and the lower back area on the cerebral cortex on the brain started having more blood supply. It started kind of like showing much stronger reaction. When they used certain points which were used for gastritis, they realized that the stomach area was somehow getting more blood supply. And also in the brain itself, on the cerebral cortex, that particular area was much more lighted.
So in other words, they identified the central nervous system areas that corresponded to, say, the legs or low back, and so showed increased blood flow during the point of acupuncture.
Yes.
Or pressure point stimulation.
Yes.
Wow, that's amazing. And so I'll have to get that reference from you.
Yes. And in another study, they also found that especially when we are treating patients for musculoskeletal problem, there was no release of endorphin whenever acupuncture points were used. And that way it would help with the relief of pain and inflammation.
Okay. So basically, we've done some studies showing from the musculoskeletal standpoint how it works. And certainly the evidence that you've cited is there's some corresponding increased blood flow in a central neurological area, which I guess implies some reverse neurological stimulation, because if you're stimulating some periphery, you're sending some reverse signal up to the brain. Now here's a somewhat of a tricky question. Let's say someone who's a paraplegic or who's paralyzed due to a severed spinal cord. Does acupuncture work well in that person, with some understanding that there's a relative, some level of disconnect between the central nervous system and the periphery? Let's say you do acupuncture in the foot or the low back, and maybe they got a C7, lesion. Do we know how acupuncture works in that setting?
Yes, even in those settings, like it works quite well. Only thing, it will require many more treatments to have desired effect compared to someone who doesn't have any lesion on C7 or L4, L5. Interesting thing is, like, they have tried to figure out whether those specific channels on which the acupuncture points are located. Initially, the thought process was like they are overlying with nervous system, but over time it was realized like it's not part of nervous system. It's not part of circulatory system. Some theories are like maybe some of them are corresponding with the lymphatic system. But in the end, they realize it's a system by itself. Like it doesn't correspond with any of the known circulatory, lymphatic, or nervous system which we are aware of. It forms its own channel pathway.
Wow, that's amazing. That's amazing. Now, it's interesting that you mentioned that, because we plan to have some guests that talks about the cannabinoid system, the endocannabinoid system, which is an area we know very little about.
Very little about, yes.
And again, could it be that acupuncture is working through some other system we've yet to identify, or perhaps endocannabinoid system, or whatever the case? So, any comments about how it might interact with the endocannabinoid system or not? I just threw that out there because, you mentioned that, okay, it's not really working through some of the systems we know about, and perhaps there's a system we don't know about. That's one system we know little about.
Yes, and you have given me something to kind of like think about, and frankly, I don't have an answer to that right now. I'll have to do more research into it, whether it is corresponding with it.
Wow, that's fascinating. That's fascinating. And it just goes to show how little we know about the human body. I mean, it's really, we have therapies that we know work, and we have a reasonable handle in terms of how to apply them. Even if I look at nutrition, I mean, we use a lot of nutrition. We do things with detox and the like, but we don't fully understand how those things work either. I mean, we say, okay, yeah, you got so many proteins and calories or whatever, hydration, but there are other mechanisms by which these things are working that we don't fully understand, and it's very humbling.
Yes.
And so, because it's easy for one to say there's a neurological connection, because you mentioned, okay, the CT scan shows increased flow in the area associated with the area that you're treating. And so it's okay, by some mechanism, maybe there's some retrograde stimulation of the brain, but then you say, okay, with someone who has a disconnect, you still have the effect. So maybe it's partly that, but not really fully. So that's, I think, is very, 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 very healthy. So I want to jump into the next area, which is really the health benefits. And I want you to kind of cover the broad health benefits, and then we'll take a break and we'll come into, say, some nuts and bolts of what you do in your practice and the like. But if you can give us a kind of a broad laundry list of health benefits, and I'm going to kind of dive into a few ones that are pretty interesting. So what are some of the broad benefits of acupuncture? Maybe go through the things that it definitely does help, and maybe if there's a list of things that say, hey, we don't see any benefit in these areas, you can do it that way if you like.
Okay, and it's interesting. World Health Organization, WHO, has come out with 40 diseases which are treated successfully with acupuncture treatment. So they have listed 40 different conditions which can be treated with acupuncture.
And this is the World Health Organization?
Yes.
Okay.
Yeah. And it's interesting, like usually patient associate, or in general public associates acupuncture with pain relief, or musculoskeletal problem. But I end up seeing lots of patients with allergies and asthma. Houston is well known for allergies. I'm seeing lots of patients whom I treat with gastritis, acid reflux, irritable bowel syndrome. Also for skin conditions like eczema, psoriasis, mental disorders like anxiety, depression, panic attacks, lower back pain, sciatica pain, carpal tunnel, arthritis. And recently I've been seeing more cases of autoimmune disorders. It is also very useful for hormonal conditions, especially with infertility, used quite a lot with perimenopausal, menopausal women. I found it very effective also in patients who are having stress incontinence, like urinary problem, retention of urine in elderly patients, or in females, stress incontinence. I'm just trying to go through all the Parkinson's disease, stroke, Bell's palsy, excellent results, trigeminal neuralgia, migraine, headaches. I'm just trying to go from top to bottom.
Yeah. I mean, you've got to, let me ask you real quick on the hormonal side of it, because, the musculoskeletal, we might get a sense of how it might work. I mean, maybe headaches, but the hormonal problem, help me with that, because if you think about the mechanism, and of course, not that we fully understand the mechanism, but, sort of walk us through how the hormones, for instance, let's say someone with PMS, because I looked on here, it's like, menstrual cramps, you mentioned PMS as the other one. So these are likely due to hormonal imbalances. I may even throw in menopause and perimenopausal symptoms. And so you may have someone with hormones that are out of balance. Do you tend to get a before and after treatment hormone levels, and do these hormone imbalances correct in association with the symptom correction?
Yes, absolutely. So when the patient comes in for the first time, usually they will walk in with lab work, and that gives us some idea about what kind of imbalance we are dealing with. But the evaluation is done from traditional Chinese medicine point of view. So not only will be taking symptoms in detail, signs, symptoms, pulse diagnosis, tongue examination. There is a list of things which we tend to do from Chinese medicine point of view. And specific points are used, or specific points are selected, which have shown very good results in treating hormonal conditions, because in acupuncture, reproductive disorders have become a specialty. There are lots of acupuncturists who are just practicing, or they are associated with fertility clinics to help with fertility problem. And so usually, like, there are specific points which we use at the time of ovulation. There are specific points which we like to use during menstrual cycle, specific points which we use after menstrual cycle. This I'm talking about more like PMS, endometriosis. But in case of perimenopausal or menopausal women, there are specific points which are used to help with the hormonal adjustment. And usually initially we go more by symptoms and signs. That gives us some idea how the patient is responding. And then we get the blood work repeated after maybe 3 months or so to see what kind of changes are seen on the hormone.
Gotcha. Wow. So, and from the fertility standpoint, is that for men and women? How about men with low sperm counts or
Yes.
other issues? Does that help men as well?
Yes, it helps men as well. Yes.
Wow. Wow. That's fast. How many treatments typically are required for, say, hormonal imbalances of like?
It just depends. Usually in acupuncture, 10 treatments are considered as one session. And we like to reevaluate after 10 treatments. Okay. Now, depending on what condition we are using, like for autoimmune disorders or somebody who has gone through fertility treatment a few times, they may require many more treatments compared to someone who is just coming to see us, just recently diagnosed with fertility.
Gotcha. Yes. Gotcha. Wow, that's fascinating. So in general, acupuncture covers a broad spectrum of disorders, and certainly we got into infertility, and I'll probably touch base in some. I'll get you to go over some of your clinical issues, but in terms of number of treatments, you mentioned 10 in the context of infertility. Is that a fairly standard number across other dysfunctions, or does it?
Yes,
is there broad?
Yes,
Okay.
Absolutely. Yeah, because I always tell patients, like, at least commit for 10 treatments. And then after that, we can just see, like, depending on how you're responding, whether you just need to come for maintenance or whether we need to see you for 10 more treatments. So it just varies from patient to patient, like how many treatments people will require. And I forgot to mention that acupuncture is also used for addictions, substance abuse. So there is a whole set of treatments which are used for alcoholism, for people to quit smoking, and especially substance abuse.
Wow. Okay. That's important. And now that one I never would have guessed. So alcohol, tobacco, and substance, illicit drugs.
Yes.
Okay. So that's fascinating. So it covers a broad area. I mean, the World Health Organization recognizes it. How about the FDA? Are the FDA approved conditions? I think there are, right?
Yes.
For
yes.
acupuncture. Is
Yes.
that list comparable to what the World Health Organization list, or is it smaller?
I think it's similar to that. Usually everybody tends to follow the World Health Organization list. But acupuncture is, I think, number one as far as integrative medicine and alternative therapy is concerned. It's the most widely accepted, yes.
Gotcha. And we have I want to quickly say hello to Nicole, Yolanda Williams, and Bradley Thomas. Nicole ask, is it covered by Social Security and disability? I'm not aware that it is. I never tried my insurance with it, but I guess some insurance companies cover it, some don't.
Yes, absolutely. Some insurance companies cover, some don't. Some workmen's compensation pays for it. We are still trying to get Medicare to cover for it. We haven't been successful with that. So they may have to inquire with their own insurance company.
Yeah, that might be a good thing that Medicare doesn't cover it, because when they cover something, they tend to restrict it, and so you may need 10 treatments, as you can only need 5. And Medicare is not as bad as some of these private insurance companies.
Oh yes, absolutely. Yes.
So they then tend to restrict. Sometimes it's better to just cover it yourself. But what we want to take a break. When we come back from break, I'd like to get you to share some case studies in your practice. You mentioned a little bit about how you use it, and maybe give us a few case studies in terms of, from A to B, what happened and so on, and some success stories, and we'll go from there. So we'll be back in about 20 seconds. You guys hang tight. Okay, we're back with Dr. Shah, and she is sharing with us her expertise on acupuncture and giving us the insights of acupuncture, which is a therapy that started with ancient Chinese medicine about 3,000 years ago. And, the science is something that is being delineated. We do know that there's some, studies showing central brain neurological response to acupuncture, increase in blood flow in certain parts of the brain associated with areas that are being treated. But it's not quite clear that it works through the neurological system. It's not thought to, but there's probably some other system or collection of systems that we have yet to fully understand and delineate. But the World Health Organization, as well as the FDA, approves somewhere on the order of about 40 different conditions, ranging from inflammatory conditions, arthritis, to hormone imbalance, infertility, and the like. And so, this has a broad scope of application, and so it's something that probably should, be integrated into any general practice. And we've used it before, and we plan to use it more in our practice. So Dr. Shah, as we go to this next segment, we talked about some clinical things. Can you give us a few case studies, 1 or 2 perhaps, patients coming in, maybe some of your more challenging patients, and walk us through that therapeutic journey, if you will?
Sure. So 3 patients come to my mind. There was a patient who was diagnosed with lupus, which is an autoimmune disorder, and was put on medication. I'm talking about I think 10 years back. And she was an old patient of mine, and then she started asking me whether we can work on her lupus diagnosis, if we can do anything about it. And I started with acupuncture treatment, and her physician was not comfortable with acupuncture treatment, but she kind of convinced him that she would like to try it on the side as an integrative medicine and see how things go. Besides the symptoms and the sign, it was very important for us to get the ANA titer done every few months to show that actually acupuncture is working for her, because without that, the physician was not ready to wean her off of medication. So as the time went by, each time the titer started coming down. I think when she came to see me, it was almost like her ANA titer was, I think, 350 or something. It was quite high. And as the time went by, it started coming down. And she was very regular about the treatments. And it took us, I think, close to a year. And we were able to completely bring her to where her ANA titer was negative. And she has been off medication for last 10 years now.
Wow.
And she
So-
comes more regularly as a maintenance, kind of like maybe once a month or once in 6 weeks, just to maintain it.
Wow. So basically, for 1 year, what was the frequency of treatment over that first year?
So first year, I think initially for the 10 treatment, she came once a week. And after that, we started stretching her treatments, like where she would come every other week. Then it was more like once in 3 weeks. But anytime she would have any issues like joint pain or fatigue, or if I feel like these are more like symptoms of lupus, then I would ask her to come for more frequent treatments. So I might give her like maybe treatments once a week, maybe 2 or 3 treatments, and then we would go back to once in 3 weeks.
So with flare-ups, you would increase the frequency. So like if she had a flare-up, she'll get 2 or 3 treatments within a week, you say?
No, once a week.
Once
Very
a week,
rarely
okay.
she came twice a week, yes.
Gotcha. So you don't do treatments more frequent than once a week, I take it?
I like to do it for stroke patients and especially for Bell's palsy.
What's the frequency
Amazing
for those
result.
patients?
For Bell's palsy, I would like to see them every day if they can. Yeah, and
For
the
how
results
long?
are
First 10
amazing.
treatments?
Yeah.
Wow. Now that's 7 days a week for 10 treatments.
Yeah, for Bell's palsy, if the patient has been diagnosed with Bell's palsy, and if we can see him immediately, like if he's diagnosed today and I can see him tomorrow, I would prefer to give him at least 7 treatments back to back. With that, the results are amazing, like almost like 90%, 95%.
Gotcha. And of course, stroke patients, the same thing, right?
Stroke patient, at least if they can come twice a week, because with stroke patients, we are looking at a longer duration. But sooner we see them, the better it is. And the results are wonderful.
So let me get on stroke patients, because I see a fair number. The ER see people with Bell's palsy. I may have seen some, but we do see people after stroke. But typically when they come in my office, it may be a week after, a month after. Is this too far out, or is this okay, even this far out?
That's okay. That's okay, because in my practice, lots of times I end up seeing patients after 6 months or a year, and that makes it very difficult to kind of revive some of the atrophy they have developed, or it becomes much more difficult to help them. The sooner they can come, even within a week, a month, as long as it is not a year or 2 years, results are amazing.
So we keep it within 6 months, you'd say that would work out pretty well.
Yes.
Now, it's individuals who've had stroke and they have no apparent residual neurological problems. Should they also get acupuncture?
Yes, yes.
Or even what people call mini strokes or TIAs, do they benefit?
Yes.
Okay, and get them in as soon as possible.
Yes.
What are the benefits there, if I may ask?
Because again, from acupuncture point of view, we are looking at more of balance. We don't want that episode to repeat itself again. We are looking at more of improving the blood circulation in central nervous system, especially blood circulation in cerebral cortex. And we have seen good results with that. Like the whole idea is like whenever there is any imbalance going on, whether there is any deficiency or not enough blood supply, this helps with it. So I call it more as a maintenance, more as a preventive.
Gotcha. Okay. Because that way it helps decrease the risk for further stroke or whatever the case.
Absolutely. And I forgot to mention, but MD Anderson has a specific department where patients who are undergoing chemotherapy also have acupuncture treatment simultaneously. So many of the patients, once they are discharged from MD Anderson, as outpatient, they like to have acupuncture treatment when they are undergoing chemotherapy, because there has been research which shows that the patients are able to handle chemotherapy and the side effects of chemotherapy are much less when they are having acupuncture treatment simultaneously. So I end up seeing lots of patients like that too.
Well, I'm going to let you go to patient number 2. I kind of got into that stroke part because we see a fair number of stroke patients, so I made a lot of notes there. So you may be getting some calls from some of my patients. Give us another scenario of a case that you've treated.
Just recently, I was seeing an elderly gentleman who is in his 70s, and he was coming to see me for lower back pain and right-sided leg pain. And then I realized like he also has been taking antihypertensive medicine. He's on blood pressure medication. And his dosage was very minimum. And I asked him about it. And he said like, yes, he has been on that medication for, I think maybe 5 years or so. And I said, like, since you are coming for your leg pain and lower back pain, let me work on your blood pressure also. We'll monitor it simultaneously. And let's see how things go. And we started monitoring it. And his blood pressure numbers started coming down. So I wanted him to talk to his physician, primary physician, if he or she were open to reducing his medication. And so we started the process. I'm trying to remember, like I continued for like 6 months where we monitored it regularly. And then she was ready to reduce the dosage, and now he's off of medication. He's just taking diuretic, and she's open to even reducing the diuretic as the time goes by. So I'm keeping my fingers crossed.
Wow. Okay, so blood pressure. How much experience do you have with blood pressure? You have a fair number of people that you...
Fair number of people, but again, let me put it this way, like somebody who has just recently been diagnosed with hypertension and is only maybe on single medication, it's easier to get them off of it. Lots of patients I end up seeing who are on 2 to 3 medications, and with that also their blood pressure is not kept under control. So acupuncture helps in keeping it under control, and maybe we might be able to reduce it to maybe 1 medication or 2 medication.
Gotcha.
Again, so it just depends what kind of problem we are dealing with.
That makes sense. And then I'm just going to throw a quick question on cholesterol before we go to your third patient. Any patients with elevated cholesterol levels or stubborn cholesterol levels?
Yes, with stubborn cholesterol level also it shows good results, but the problem is lots of time patients are not ready to commit for acupuncture treatment for long-term basis, because I like to get the cholesterol level checked after 3 months. And lots of times that compliance may not be there. Like it's easier to treat them when they are coming to see me for some other issues. And then I just throw in like treatment for cholesterol. But just patients who come for cholesterol, they would rather take the medication instead of having acupuncture treatments.
No, I understand. But the treatment is the same in terms of you get your 10 up front that are weekly and then once a month after that.
No, but sometimes when we are dealing with high cholesterol or like even in case of blood pressure, I might continue once a week for a little longer duration also. It may not be just 10 treatments. It may require 20 treatments depending on,
Gotcha. Okay. So that's... So the metabolic things tend to be longer and more frequent, I take it, than as opposed to say musculoskeletal disorders to some extent. Okay. And cholesterol disorder, is that you find that to be more of a problem of the liver? There's some issue with liver metabolism or some imbalance in the liver?
Yes.
Yeah, that's what I get a sense of. So this is fascinating. And how about your third patient that came to mind?
I'm trying to remember, like, because since you mentioned liver, like I'm just going to mention it. So one of my patients who used to come to see me, she came to see me for allergies, and she mentioned, like, by the way, my liver enzymes are very high. And they were not sure. They did thorough testing. Everything came back normal. They didn't know why the liver enzymes were staying so high. And her primary care physician mentioned, like, if they continue to stay high, then we may have to get more detailed investigation done. We might have to refer you to a liver specialist. We might have to do more thorough investigation that time. And I said, okay, like, let me work on your liver. Let's see. The only way we'll come to know, like, we are making any progress is when you get your blood work done again. And since she was coming for allergies, like, I started treating her, focusing on liver enzymes also. And she got her blood work done, I maybe a month and a half, because I wanted her to wait till, but I think she wanted to get it checked, and the liver enzymes had dropped. So we continued with the same treatment, and then after 3 months, we got her work done again, and the liver enzymes were completely fine. So she didn't have to go to the specialist. We don't know what caused it, but her primary care physician was also fine, and they said, like, we'll just keep an eye on it. It looks like everything is just fine.
Wow. So, I mean, let me ask you, I'm going to throw this question is part question, part hypothetical conjecture. Is it possible that with acupuncture of different approaches, you're creating some overall biochemical physiological balance? So you bring the body into balance. And so these different conditions go, so I'm on this, okay, here, cholesterol, blood pressure, et cetera. Is it, I mean, my perception of these quote unquote diagnoses are pretty much they're the same thing. They're just different manifestations of said common
absolutely.
process. What do you say? Yeah,
you said it really well, because it's interesting, like the patients who come for acupuncture treatments, and they always mention that, I used to catch flu every year, and since I've been coming for acupuncture treatment, I'm not catching flu like before. Or patients who had pneumonia every year, like especially elderly patients, and they'll say, I've not had any pneumonia, or I'm not having sinus infection, which I used to get every year in winter. So there is that overall sense of well-being. Like, they will also mention that I sleep really well, my fatigue is gone, and I don't feel tired like before. I'm not catching cold like before. So the whole idea is to have that overall sense of well-being and balance.
Wow. Nicole has a great question here. So she said, this may be an odd question. I think it's a great question. Is it common to have an emotional detox when going through acupuncture? She had one in her 20s. Remember, it opened a flood of emotion, lots of crying after. Can you talk to us about that?
Yes, it's interesting. Yes. And with some of the patients, like when I'm expecting, like there might be some emotional detox, like as soon as I give them the treatment, and I'll tell them, like, don't be alarmed, but the likelihood is you will start crying. You may not be able to stop it for a few minutes, but it's part of the treatment. So just don't worry about it, let it go. And it's form of detox. But I see that quite often. It's very interesting, and that was a very good question she asked.
Yeah, I never would have gone there. I'm glad you asked that, Nicole, because that gets to the previous point we were making in terms of this whole biological balance. And we tend to leave the brain and emotions kind of in a separate corner, but they're really integrated with the rest of our biochemistry and physiology. And the fact that somebody, she mentioned that emotional detox is interesting. And now, and it's interesting in the sense that it gets me to reflect on what we do with the nutritional stuff, because we see a lot of emotional connections with people on nutritional detox. Now, I just think that they're crying because they're giving up their favorite foods, but there could be some other things going on there as well. But I mean, that's a fascinating thing, which underscores a lot of things. And so I had a series of treatments of chronic sinus infections back then, and yes, lots of crying after each session. So that's amazing that, and Liz Allen says acupuncture brings your body into balance. Now, what can you do with hair growth? See, I've got some issues here. All of my guests that come on, I always ask that. Well, not always, but often ask that. Have any hair growth studies? hair growth is one of those deep issues that's hard to address. It's probably due to a lot of different things. I mean,
yeah, it's a lot of different
having
things.
multiple kids grow up in college, I think that's probably one of the things.
Yes.
But so I mean, this is really fascinating because it's an area, and again, I took quite a few notes here, and as we look to broaden our scope of natural healing with our patients, I may be calling on you to sort of work with us on some patients who, have a complex set of conditions, and because I think it's important to, the more I go into this space of natural treatment, I try to be as foundational as I can at the outset of managing someone or helping someone manage a health problem. So we oftentimes treat very superficially. You get a pill for blood pressure, a pill for cholesterol, and even with supplements, you get a supplement for this and a supplement for that. But creating foundational balance, I think, is essential. Now, maybe somebody can benefit from a supplement here or there or whatever, but if we start by balancing the foundation, it seems like it perhaps minimizes our need for working up at this level, but also substantiate the overall health and well-being of the patient. What are your thoughts?
Absolutely.
Yeah. So this has been great. So this one other comment here. One acupuncture that I went to was really great. I felt so relaxed even days after. Another doctor, I didn't experience the same. Guess it's the acupuncture. Perhaps I was in worse condition. How do you explain the variation in experiences from one treatment to another, one practitioner to the other?
Acupuncture treatments are more kind of like, what's the right word? I think of acupuncture as a combination of art and science. Because acupuncture is more of an individualized kind of customized treatment. It's not like if you have headache, like I'm going to use that point on the head. I may use that point on the hand, but besides that, I'm treating you. So there will be certain specific points which I'll be using to address your imbalance. And lots of times, like certain practitioners may tend to follow only certain group of points, and that because of that you may have different experiences. Again, just like medical practitioners, it depends on what kind of training you had, how skilled you are, and all those things are also going to play a role. Or even many times, like there is a specific branch of acupuncture which is called as Korean acupuncture, Japanese acupuncture. There are different even branches of general acupuncture. So I think there are lots of variations with treatments.
Wow. Amazing. So I mean, that's pretty fascinating, and I gather from what your recent comments that you look at the total patient. So I imagine, so if someone comes in with a headache or a knee, low back pain, so okay, great, your head hurts, low back pain, but tell me more about you. And then I guess you put all that together, and your acupuncture therapy may not be based on the low back pain and knee problem only, but it's say a global, because there may be other things that they're not symptomatic from. That's, I mean,
absolutely.
Okay.
Absolutely. Yes, absolutely. And then, as I said, like the patient might be coming for back pain, but like, as I gave you an example, like my other patient had hypertension.
Yes.
So I'm addressing that. Now I'm seeing his wife who has been having insomnia. So I've been working, and she has been dealing with some grief, some stress associated with that. So with her treatment, even though she's coming for knee pain, but I'm also giving her more of a holistic approach where I want to address her grief, I want to address her insomnia. So again, like it's going to more of a kind of treatment where you are treating the person. You are treating not just that specific organ or specific part of the body. You want that generalized well-being, that the patient should feel better physically, mentally, emotionally, all over.
Wow. Fascinating. Well, Dr. Shaw, this again, as usual, has been a fascinating show. And I mean, I've learned a lot. I'm taking a lot of notes. And, I think my patient would be benefiting from, some of this insight. Any final words to our audience before we sign off?
I would like the patients to at least consider alternative medicine in the sense that it is looking at you as a person, like trying to treat you, trying to kind of balance if there is any imbalance going on. And many of these alternative treatments, like for example, acupuncture, in the past I've talked about homeopathy, it also focuses on preventive medicine, which is extremely important. Because if you're able to prevent any of these from happening, you don't need to go through the whole process of seeing a doctor or going to another practitioner, taking all the medication. You want your health to be at a good place. And if you can prevent it by using all those different modalities, I feel like that would be one of the advice I would like to give. Keep your mind open. There are lots of different modalities out there. Just because it doesn't fall under conventional treatment or conventional medicine, that doesn't mean it doesn't work.
Wow. I couldn't have said it better. Dr. Shah, thank you very much. I'll see you backstage as I close out. I appreciate it as always, and our audience appreciate it. Let's give Dr. Shah a digital hand of applause as we close out. Thank you very much.
Thank you.
We'll be seeing you sometime down in the future. And I'd like to reiterate Dr. Shah's point in terms of preventing illness. Now, oftentimes by the time someone sees one of us, myself or Dr. Shah, they have some, illness, some symptoms. So there's some level of reversal that's needed. But there is a preventive aspect to this because you want to prevent the progression of whatever the condition is. And you want to do that in a fashion that's least intrusive on your body. We in medicine, traditional allopathic medicine, and myself, my well-meaning colleagues, when we see patients, we may do procedures or prescribe medications and the like. And there's some benefit there, especially in the acute setting. However, oftentimes these, aggressive therapies may be applied maybe too soon. That's one. Two, oftentimes people with conditions that would benefit from a preventive or less invasive or less intrusive therapy, wait too long before, they go in and have these issues addressed. I think it's important for, us to always try to bring our bodies in balance. And we live lives that are, in many cases, very stressful, both physically, emotionally. We have busy lives. Most of us are away from nature. We're working in offices and the like. So I would encourage you to reach out to a natural practitioner, a homeopathic doctor, acupuncturist, if it's not Dr. Shah, someone you may know, to consider one of these modalities to help prevent an ongoing illness, or if you have some minor condition that needs help, you should consider one of these areas, because I think that is something that we need to apply more to our natural health approach to decrease progression of disease and prevent other diseases, prevent advanced progression of mild forms of disease. So again, acupuncture, I think, is one of those areas that's very fascinating. I've learned a lot, and I hope you did. If you got a lot out of this show, please subscribe if you haven't, and please hit the notification button. You'll get notifications of any future shows. And of course, share this with any and everyone that you think will benefit from this information. Until next time, I want you to keep it fresh, natural, and live.